Hey everybody, welcome back to another edition of What's for Dinner. It's about 10 minutes till 5 on Monday. I hope you're all doing fantastic. The weather was absolutely gorgeous today outside, cool and dry. For those of you down in Florida, I hope you're slowly but surely getting your stuff back together, your life back, and getting things repaired and mended and hopefully getting back to some sort of semblance of life. In any case, just remember, nothing you see here tonight should be considered medical advice. Reach out to your highly professional and trained medical provider. Teresa, what do we want to start saying about that? We wanted to talk about people who are trained.
So if you're going to go for hormones, you got to look on worldlinkmedical.com for a hormone provider near you. And if you want metabolic health, I would start at, what's the website for Symposium?
Oh, okay, so at the SMHP, so the Symposium for Metabolic Health, or SMHP. So if you look that up, I'm not sure what exactly the website is for that, but if you look up SMHP, Symposium for Metabolic Health Practices or Practitioners, you'll find that.
Those people have been trained in nutrition, low carb, and all of the health benefits. So don't just go to your regular knowledgeable provider and ask about hormones or metabolic health because they don't know.
Yeah, also lowcarbusa.org.
They
have a provider directory on there as well. So you can find health coaches, doctors, dietitians, nurse practitioners, nurses, things like that. And then, so just kind of continuing on with that, just want to let you know this is for information and education purposes only. If you have any questions, make sure you reach out to those providers we mentioned earlier.
Yep.
So with all that being said, what's going on tonight for dinner?
So I made you the beef because you don't mind it. I don't like this beef. It's not lean enough or fatty enough for me. So I just made you, I browned it with taco seasoning, eggs, and cheese and butter.
Yeah. So we bought this ground beef from we bought a whole cow, and the ground beef, we're not 100% sure how lean this is, but it is very lean. So we prefer our fat to protein content to about 30 to 70. So we like about 70% protein, about 30% fat. And we verified that by picking up some ground beef from our local butcher and asking him to make it like that.
Yeah.
And it was delicious. So anyway, this is still good. I don't mind it. It's just a little bit too lean for Teresa.
Well, you were in the military, so you don't mind
I
a lot.
I guess my standards are lower than
low.
most. So, and then you got chaffles going on.
Yeah, I made a sandwich. So I just made chaffles so there's 2 over there. So 2, 4, 6, 7 chaffles was 2 cups of shredded mozzarella, 4 eggs, and a half a cup of almond flour mixed together, and then I just put it in the waffle maker and cooked it. And then I'm gonna make a little sandwich because this is really protein packed with the eggs and the cheese. So it's not like I'm gonna go hungry.
Yeah, and you'll put pickle and tomato, a little bit of onion, and then throw some deli meat on there. Right?
Yep.
Okay.
I gotta
get some
deli meat
cheese
out.
and whatnot. So okay. All right, well that looks good. I'm getting hungry. So what are we going to talk about tonight?
So just, every single day I see, anywhere from 3 or 4 new patients a day, and every single day, at least most of them, I did see someone that's not a hot mess today, but most of them have stories and they bug me every time. But this one patient came in this morning. She was 49. She is 49 years old, and she sees one of her friends sees me. So she's been kind of telling her, but she's been trusting the system. Although it's been failing her daughter also, her 20-something-year-old daughter with Hashimoto's and thyroid. But 3 years in a row, 3 or 4 years in a row, she's been going to her GYN in town that she loved. And I'm like, I was about to say everyone loves them until it comes to menopause. And she said until menopause happened. So she's bleeding super heavy. So they tried to do an IUD, even though she has the Essure coils in her tube. So she already has birth control. They tried an IUD, it got dislodged and went somewhere else in her uterus. So she had to get that taken out, and she kept bleeding. And then they have her on the birth control pill now. She's 49 to try and stop the bleeding. And I was like, sometimes I fail, but you need progesterone. They even tried to give her a little bit of estrogen. And I was like, oh gosh, like you're bleeding. You have too much estrogen and not enough progesterone. But so 3 years in a row, she went crying.
Can you slow your roll one second there? We just lost our connection to Facebook. So it's reconnecting right now. And it looks like it just reconnected. Okay, so pick up where you left off.
So she went for 3 years in a row crying, just saying, there is something wrong. I don't feel good. And guess what she got offered?
I'm going to guess an antidepressant. Huh, that's just odd, really odd.
Every single time she said, go ahead.
Well, maybe she had a deficiency in her labs for antidepressants, and so they're just replacing those.
She said, I feel like I'm in perimenopause. And they said there's no symptoms with perimenopause.
Oh, there's nothing, huh? Is that made up? Is it a mental thing? You just make it up in your head?
So perimenopause is obviously before menopause, and that can start, in my experience, around 35 to 40 and last until you go into menopause. Okay, let me do the math for you. It's 15 years or so of no symptoms, not needing treatment. Give me a break. So I just don't know. You know, you're a nice man, mostly.
Most of the time, yeah.
Why do women get treated like that? Like, you would not say that to somebody in good conscience. You're nicer to the people at the grocery store than these providers are to women.
Well, I mean, let's look at this from their lens or their perspective, and that is that in order for them to get paid or to get reimbursed maximum reimbursement from insurance and or possibly pharmaceutical companies, depending upon the drug that they're prescribing, if there's no money to be made in it, why would you want to address that problem? They want to address a problem that's going to maximize their
I get that, but now you're putting people, humanity, below money, and that just doesn't sit well with me.
And that's corporate medicine. That's exactly what we're talking about here, unfortunately.
So she left the last appointment at her GYN office and sat in the parking lot, called my patient, her friend, and she was like, you have to go here. So this is kind of easy because she's like a normal person, likes her. When I say normal, I mean her life is together. She likes her kids, her family. Some people have marital problems, they have kid problems, they have job problems, they have all these problems that hormones aren't going to fix all of them. But it's going to be relatively easy. She just needs to get on. She's also has hypothyroidism and is on Levo only. So if you know me and thyroid, that's not good. She needs the T3 portion. But anyway, I'm going to get her on all of that and we'll just turn this around. But I just think if men went through menopause, things would be very different.
Yeah, 100%. So really quick, we got a couple more minutes. Run through the female hormones that you can replace or you typically replace, and what do they, each one of them affect? To talk about those.
So early on, progesterone leaves when you're about 35 to 37. And when so estrogen and progesterone are balanced. When progesterone starts to leave, speaking from experience, we get crazier than God made you. You overthink, you overreact, you start worrying, you start craving weird foods. That then it activates cortisol. You get belly fat. You can't sleep. You're a nervous wreck. Like, I remember just having so much anxiety on top of eating processed foods. So progesterone, when she fails, she's the hormone of contentment, helps with anxiety, depression, sleep, and an evenness of mood. Also, this woman has had 2 miscarriages. She has 3 kids, 2 miscarriages, and menstrual migraines. That is always progesterone. So when you go to a GYN and you complain long enough, they're going to give you estrogen. You don't need estrogen. I don't know if she's going to need estrogen at 49, but it's a good possibility she doesn't. So if you give a woman at her age more estrogen, what's going to happen? This disparity is going to get further apart. So you're going to make more symptoms of craziness and all that other stuff. So if estrogen falls, which she does eventually. So for me, I started estrogen on my 50th birthday. Then you get hot flashes, night sweats, dry vagina, painful sex. But later on, because a lot of women can get through that, you can white knuckle it through menopause, 3, 5, 6 years, fine. Dry vagina doesn't go anywhere, but the hot flashes and that miserable feeling goes away. But you also get estrogen protects you against osteoporosis, heart disease, and Alzheimer's and dementia. So you want estrogen and progesterone balanced back up.
Okay. What about
if you don't have a uterus, your GYN thinks you do not get progesterone. So I just told you it's the hormone of contentment, helps with anxiety, depression, sleep, evenness of mood. You're going to say, I want it. And I'm going to say, oh, you don't have a uterus. You don't get it. No, let's just forget you have breast receptors for progesterone. You have bone receptors. You have you have brain. I mean, like all this other stuff, but because you don't have a uterus.
Okay, we just lost connection again, so it's trying to reconnect on the Facebook side here.
Oh, shoot.
And we've got about another minute to go here, so I don't know if you want to hit thyroid. Here we go, we're back up on Facebook. I don't know if that shows up on everybody's end on Facebook as like it's not working or whether it's just a little hiccup. Yeah, or we freeze. But,
and then testosterone. Let's talk about testosterone. I can talk about thyroid and its whole thing. Testosterone is sex and muscles. You cannot have a libido, and none of these women have libido by the time they come in to me because libido goes way far before 35. And what they I remember when I was younger, they would say, oh, women get libido. Such gaslighting. Women get libidos in your 40s. No, you don't. Everything's gone in your 40s. And by then you have kids, and women, we don't really think about sex. Guys think about sex and food. We think about everything but sex, but we also think about food. But anyway, testosterone, besides sex and muscles, it is zest, vitality, motivation, strength, stamina, get up and go, get your list done. All the hormones help with anxiety, depression, blood pressure, cholesterol, heart disease, Who doesn't want them?
Wow. Yeah. Good stuff. It's almost like you said that before. All right.
Many times.
Well, did you have anything else you wanted to cover word about?
No,
time
I
right
just,
now, so?
you know, and then I also saw a 60-year-old that came in for labs, and she signed up for the program, went on hormones, and she said, am I too late? I wish I had known this sooner. And I was like, it's never too late, but I went on it at 42. So are you late compared to that? Yes, but it is negligence for providers to talk women out of hormones and let them live miserably, and some people die miserably because they were not allowed to start hormones. It's a travesty. It's disgusting. I don't even know the word. It's mean.
All right. Well, how about a happy note on the end?
Okay. We love you.
We love you. This all can be corrected. You know, you just did a
corrected.
little bit of hormones and maybe some changing in the way you eat and things like that. So.
But, you know, information's getting out there. Girlfriends are talking to girlfriends. I have a couple hairdressers. I have one hairdresser that sends me so many patients because you sit in the hairdresser's chair for 2 hours. You talk about all the things. We have to help each other. We're all walking each other home to eternity.
Definitely.
Hopefully in heaven and not. That's a whole other subject.
All right, yeah, for sure. All right, guys. Well, tell us what you're having for dinner. Let us know if you have any questions, and we love you
So much.
And as always, God bless, and we will see you next time.
Bye.
Bye.